Hi, my name is David Emerson. I'm a long-term multiple myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome. This vlog post is about a very common issue, though it's not routinely discussed by conventional oncology. Essentially, multiple myeloma in the elderly. And let me explain my definition of elderly. The average myeloma patient is a 69-year-old. That means half of everyone who gets myeloma is younger, half is older. Most, if not all, clinical controlled trials only include up to 75-year-olds. Anyone older than 75 is essentially flying blind. You have myeloma, yet none of the studies, none of the trials, none of the therapies have been tested on the 75, 80, 80, and I had a cancer consultation yesterday, in fact, with an 82-year-old and her caregivers. Essentially, induction therapy had thrown her for a loop. Your basic standard of care, Velcade, Revlimid, and dexamethasone, standard induction therapy that everyone undergoes, really knocked her back. To me, it's not uncommon that an 82-year-old would have a hard time managing that much toxicity. Therefore, consider lower dose either Velcade or Revlimid. In this case, it's common for standard of care patients to undergo, let's say, 5 milligrams of Revlimid or Velcade, as well as complementary therapies, exercise, nutrition, eat right, eat cleanly, as well as integrative therapies. Curcumin has been shown to enhance the efficacy of Velcade. Bottom line, all to say, anyone over the age of 70, 75, depending on how healthy you are, should be really thinking about a different sort of therapy plan than the average, than the standard of care. In my mind, that means induction therapy, question it. Autologous stem cell transplant, which is routinely pushed by conventional oncology. Maybe you want to give it a second thought. Maybe you don't need it. In my mind, your goals, quality of life, might be more of an issue than quantity of life. All I'm saying is things to think about. If you have questions or comments, feel free to email me. Email me a question or a comment, and I will reply to you ASAP. In the meantime, thank you for your time, attention, and be well.